Dr. Art. Thanks for talking to me today.
My pleasure.
We're talking today because we're getting up to New Year's, and everyone makes resolutions. And I have a pet peeve. I mean, I'm a pretty easygoing person, but smoking drives me crazy. I can't understand, with everything that we know about it, that people still smoke. And so I'm hoping we can convince some people to quit.
It's the hardest thing. You know what? I ran a really busy practice, and we had all sorts of patients addicted to all sorts of things, and had a lot of counterculture.
It is an addiction, isn't it?
Oh, absolutely, and it's an incredibly difficult addiction to deal with. I think everybody who's ever smoked, I smoked, and knows how hard it is to quit. I'm very willful, and I was able to do it when I wanted to, but it was hard. It wasn't that easy. The average smoker, they say, makes 8 to 12 attempts, somewhere in there, depending on the numbers you read, attempts to quit before they quit. It shows you before they finally are able to do it. The good news is that most of them are finally able to do it if they actually keep trying. But still, it's very, very hard to do.
I was doing a little bit of research because I like to think I'm sort of a quasi-journalist. The Heart and Lung Foundation, they said in 1965, 50% of, I think, Canadians over 15 smoked. And today we're down to 18.
It's become uncool, which is a really nice thing. I remember the first time that came home to me. I was driving a teenager in the car, and we're talking about smoking. He said, "Oh, geez, Artie, it's so uncool to smoke now." That's how you win. You get the young people to think it's uncool. And we're down to, I think the BC government likes to say it's about 14 to 15% of the population smokes now, which is amazing. When I was growing up, when my dad smoked too, I don't remember him without a cigarette in his mouth. Everybody did that. That's what you did. You had ashtrays everywhere you went. You had ashes everywhere you went. And, those were the unfiltered days.
The side effects.
Oh, God, it was ugly, and it must have smelled like crazy. But you didn't know that because everything's reeked and everybody smoked. So in medical school, we had a lot of the students smoked. A lot of us smoked. Even as an intern, I remember at the hospital where I interned, there were ashtrays available to the interns in the emergency department.
It seems so contrary.
So, history. It's done, and thank God we've progressed from that. It's become really uncool. And I think the rest of the world we've done a really good job in convincing many parts of the world how bad it is. So we travel a lot in Europe, and whereas 20 years ago, there was no question anybody who smoked anywhere they wanted to. Now there are all sorts of restrictions. They don't listen to it as well as they should. In France, you're not supposed to smoke in restaurants, I think, and you still see them lighting up.
There's a lot of cigarette butts in Italy on the street,
well, but they ask your permission, interestingly. Where we're sitting, I forget where it was, somewhere in Toulouse, and the guy sitting next to us said, "Do you mind if I smoke?" And stupidly, I said, "I don't," but I should have said, "You know what, I do. Go outside and do it." I think he would have smoked anyway. So
You're one of those polite Canadians.
Well, that's it. It's his country. Let him smoke. But he asked, which it wouldn't have happened 20 years ago.
It's a lot different now. You're right. There's a lot more restrictions. There's a lot of products out there to help people quit. There's the patch. There's gum. The latest thing I saw, which getting back to the addiction side, is this electronic cigarette. So it has a mist that comes out, but it has none of the chemicals. But all of the habits and the function of actually keeping it in your mouth and holding it, that must help get you past some of the addictive feelings?
I don't know. Interestingly, there was an article yesterday that I read about how successful it is, and yet that lots of agencies don't want to jump on the bandwagon of using it. I don't know enough about it to comment. I know it's out there. I did speak to some of the London drug pharmacists about it, and they told me it's flying off the shelves. It's incredibly popular. So maybe that's one of the benefits. I think time will tell. A lot of things are fatty. It just came out, and it's a fad, and people want to try it. And will they stick with it? Will it actually lead to smoking cessation? And what you want is data on 5 or 10 years of use, not data on 1 year of use. So I'm hoping that it'll do. I don't care what works. If amputation, no, we shouldn't take it that far. That's a joke. We're not.
That was a joke.
It is a joke. But whatever works to minimize smoking is all to the benefit. And that, you raise an interesting point, though. Each person, there is no formula for this, okay?
That was my next question.
Yeah, much like everything else in this business, ignore that. Much like anything else in this business, every individual will find their own path. So you may read that gum will work terrifically for you, and you try it and it does, and then your twin tries and says, oh, it didn't work at all. That's the way the business works. That's why you should try all the different methods and pick the one that you think you're most likely to stick with, because they all have different side effects and different ways of taking them. And pick the one that you're happy with and try it. If that didn't work, hey, you know what? Try another one. If that doesn't work, maybe go back to the first one. 6 months later, your situation has changed. That's the way this stuff works. Keep at it. When you're ready, it'll happen.
And it's worth it to keep trying, because I was writing an article about cholesterol the other day, and smoking affects the good cholesterol. It cuts down on the good cholesterol in your body. So it affects your health in a lot of different ways, not just cancer.
There isn't a negative consequence on health that I can't think of that is related. Yeah, smoking related. Everything, you name it, it increases the risk of that. With one or two exceptions, which I won't get into because people who have those conditions will tell me, okay, it's good to smoke. There are a couple of conditions in which actually smoking does help, but we're not going to mention those. For everything else, smoking makes it worse. And if we haven't discovered it does now, we will discover it does if somebody does the appropriate research. But particularly, the most important reasons to sell it to young people is the risk of heart disease and cancer, and cardiovascular disease, heart disease and stroke, which just goes up so dramatically. It's amazing.
It's so funny. When I know when I was growing up, I had a couple friends that tried it, and it's such a horrible first experience that I think the chemicals in it must really be strong to convince them to keep doing it. In my day, it was I think a coolness factor too that you don't see anymore.
No, you don't. And although interestingly, there are articles about this too. You do see it in the movies. It's become cool again for the cool characters in movies to smoke, which is ridiculous because it's a killer. If they were to make it uncool, then it would certainly help among young people. But it was only in 1964 that the Surgeon General of the United States linked smoking to all those deleterious consequences, particularly cancer. So we've only been battling this for 50 years. Public health takes a long time. It's very hard to change habits, and maybe in the next 50 years it'll become much less cool. One of the big battles with smoking now is in the developing world, where it's still terrifically common, much higher rates of use. It's much harder to combat in the third world. I mean, if you don't think you're going to live to be 65 or 70, why should you care if you're going to get heart disease out of it? So it's much harder to sell stop smoking there. But again, they're making inroads, so the world will learn.
And different.
You know what? The other thing, I want to make this as an editorial comment. It's such a dirty habit. We live next to this beautiful, beautiful park. You go on these isolated little trails, and you still see butts. Like, who has the right to do that to my world? That's what gets me so upset about smokers. I don't care. You want to kill yourself, go into the room, do it. You don't have a right to do that to my world, or flick your ashes out the car window so that, because the whole world's an ashtray. There's something wrong with that.
And one of the most beautiful cities in the world too.
Oh, but everywhere, smokers, they've been socialized to just get rid of their ashes. So, this is going to turn into an anti-smoking diatribe, which is, I don't want it to be. It is a filthy habit. It does impact everybody else. Any smoker, you can't be green and be a smoker. It just doesn't work. It's a contradiction in terms. But most important, you want to stop smoking for your own health, and you want to stop smoking for the health of those around you. There's absolutely no doubt at all that there is this effect of secondhand smoke. They're even talking about third-hand smoke, but that's too complicated an issue. But the secondhand smoke, kids who grow up with smokers have way more pneumonias, way more days off from school, all those things. So.
Not to mention the money you'll save.
Oh, absolutely. And you know, if you have all that much money to waste, send it to me. I can put it to good use.
And just because, you know, we talked about earlier about getting email, I said most beautiful city in the world because Dr. Art lives here in Vancouver. So everyone, you're right, everyone has a beautiful city that they live in.
Absolutely, yeah. You know, we travel a lot.
No angry email.
Yeah, I love living here, and it is, for me, an amazing place to live. But, you know, there are a lot of beautiful places in the world. So.
Well, thanks very much for your time.
My pleasure.